autopsy, and autopsy techniques. Now, what are the meaning of autopsies? We all know autopsy is known as postmortem examination. In short, we write down PME, postmortem examination. But we use a word necropsy also for this. Why do we use word necropsy? Necro. Whenever there is a necro, the meaning of necro is dead body. DB is a dead body. So dead body examination, it would be necropsy. We all know the study of death is known as thanatology. Thanatology. So it is related with thanato. It is also known as thanatopsy. So we can see autopsy, necropsy, postmortem examination, and thanatopsy. Necro means dead body. Now, few history part I'm coming to. Now, overall first autopsy was conducted in 1302. सबसे पहले first autopsy was done, and it was done by Bartolomeo di Varignana. Bartolomeo di Varignana, but you can remember Varignana. And this autopsy was conducted in Italy. This is the first very, very important fact-based question. Bartolomeo di Varignana, 1302, Italy. But if you get a question, the first overall medico-legal autopsy, I would use a word medico-legal autopsy in India. Medico-legal autopsy in India, it was conducted by Buckley. Buckley, there are a few words, Edward Buckley. And it was on the body of Mr. Wheeler. And you can get a question, it was conducted in Chennai. So in India, it is in Chennai. Overall, it is Italy, Varignana, and Buckley, who was the dead body of Mr. Wheeler. And actually, you can get a question. This was a case of arsenic poisoning. This was a case of arsenic poisoning. So if you want to go in further detail, you can get this question also. Now I am coming to autopsy types. In court of law or in legal procedure, I told you two types of inquest we have. One is police inquest, second is magistrate inquest. So my dear friend, the first autopsy is medico-legal autopsy. It is on the inquest of either police or on the inquest of magistrate. Medico-legal. As the name suggests, medical as well as legal. That's why I used the word police and magistrate. The investigating officer are police or magistrate. I told you it's a 174 CRPC for police inquest and 176 CRPC I told you for magistrate inquest. My dear friends, medico-legal autopsy are mostly done for unnatural death. These are mostly done for unnatural deaths, not for natural death, unnatural death, suicide, homicide, accident. These are done for this. Here, relative consents are not needed. Relative consent is not required at all. No relative consent required. It is for the law purpose, I would say. It is for the law purpose. And it is the autopsy of complete body, whole body. It is the autopsy of, I would say, whole body, not a specific part. We go for postmortem examination, the complete body. And we go for the cause of death. Yes, COD, that's the cause of death. Sometimes manner of death, but most of the time cause of death. Time since death. Cause of death, TSD, is time since death. We ascertain by this autopsy. This is medico-legal autopsy. And my dear friend, most common autopsy in India is medico-legal autopsy. What is the reason behind this? Because in India, the unnatural deaths are very, very common. So we go for autopsy. Most common autopsy in India is medico-legal autopsy. Now, the second word is pathological or clinical autopsy. Pathological or clinical autopsy. Remember, my dear friends, two important words. Here, relatives' consent are mandatory. The consent from relatives are mandatory. C for consent. It is done like sometimes or mostly for natural death. Natural death. Unlike, like I'm giving a very simple example. Someone died due to myocardial infarction. Someone died due to MI, myocardial infarction. And we want to get the specific part autopsy. It's not the whole body. It is the specific body cavity. So it is for specific body cavity. We go for autopsy. So for myocardial infarction, we'll examine the heart. We'll examine the heart. So we'll open this thoracic cavity. This is a specific part of the body, not the complete body we require. My dear friend, in medico-legal autopsy, the dead body is handed back to the investigating officer. The dead body is handed back to the investigating officer. Here in clinical or pathological autopsy, we are taking consent from the relative. So definitely the dead body is given back to the relative. Now, you must be thinking, sir, what is the reason of pathological or clinical autopsy? It is for academic purpose. It is for academic purpose. It is for your increase in knowledge. It is for academic purpose or increase in your knowledge. Say, we want to see the coronary artery, the blockage in the coronary artery. This is pathological or clinical autopsy. Consent of the relative is mandatory. Very, very important. Sir, in medico-legal autopsy, it is done by forensic expert. Registered medical practitioner in India, RMP, is a registered medical practitioner in India. So the person should be forensic pathologist or forensic expert. That is a very important one. And clinical autopsy can also be done by registered medical practitioner, but forensic expert is not needed. But every registered medical practitioner should know how to get autopsy. So forensic pathologist, we can use a word for medical legal. Normal, like pathologist, we can use a word for pathological or clinical autopsy. Normal pathologist, we can use a word. Now I am coming to psychological autopsy. Now most of the people are confused. Sir, a very important word comes, like a person committed suicide. A person committed suicide. Now you must be thinking, the person committed suicide, it's an unnatural death. It is an unnatural death. So if it is an unnatural death, it should be the medico-legal autopsy. My dear friend, actually it is not the postmortem examination. Psychological autopsy is just a kind of interview we are taking. Just a kind of interview we are taking from the family members. Family members. Question, answer after suicide. Actually, we want to know the mental status of a person at the time of suicide. So to know the mental status of a person, we go for interview. We go for interview. We are asking questions to the friends, family members, relatives. And even if you see, we want to check the social media sites also, Facebook, WhatsApp, Instagram, to see the status of that person. What was the last status? What was the last talking with someone? This examination to know the mental status, because most of the suicide are in depression. So we want to know the mental status of a person. This is known as psychological autopsy. So it is not an autopsy. It is just to know the mental status at the time of suicide. Now, virtual autopsy. Actually, my dear friend, it's a kind of imaging technique we are using for cause of death. A visual imaging techniques we are using for cause of death, like we are using CT scan, MRI. Like this is done in developed country. This is done in developed country. Definitely, India is not a developed country. India is a developing country. So sometimes for dead body, we don't use the CT scan or MRI, but virtual autopsy, or it is also known as virtuopsy. It is also known as virtuopsy. So virtual autopsy or virtuopsy are same. It is the cause of death. Cause of death we ascertain by visual imaging or imaging techniques like CT scan or MRI. This is known as virtual autopsy. A very, very important word. Negative autopsy and obscure autopsy. My dear friend, what is negative autopsy? Negative autopsy means negative. That is no cause of death. If you are not able to find out any cause of death, no cause of death, after postmortem examination. In postmortem examination, what you have gone through? You have gone through the gross finding. You have gone through the gross finding. You have gone through all the gross finding of the body, all the internal organ gross finding. You have gone through everything. And you have gone through the additional investigation, additional things. You have gone through histopathology, HP, histopathology of the organ. You have sent all the organ histopathology. You have gone through the toxicological analysis, toxicology of the body, toxicology of the organ, toxicology of the blood, every sample. You have gone through the lab investigation, laboratory investigation. You have seen all the clinical things which is required, clinical investigation. But sir, still you are not able to get the cause of death. There is no cause of death after this. This is known as negative autopsy. And my dear friend, the total number of negative autopsy are 2 to 5%. Sometimes the negative autopsy may be due to lack of experience or lack of skill also. The total number of negative autopsy are 2 to 5%. Now, what are the causes of death where you get the negative autopsy? Now, if someone died due to vagal inhibition, vasovagal shock was there. If someone died due to laryngospasm, if someone died due to laryngospasm, or if someone died due to vagal inhibition, or if someone died due to epilepsy, sometime we don't find anything. This is known as negative autopsy. Negative means no cause of death. Now, what is obscure? Obscure, a very simple difference from the obscure and negative autopsy. In obscure autopsy, you get minimal finding. Minimal finding. Minimal gross finding, I would say. Or you can say inconclusive finding. Inconclusive finding. You got minimal finding and inconclusive finding. Yes. Now, by this you cannot give cause of death. Now, for this you are going for additional investigation. You are going for additional investigation. You are going for histopathology. You are going for toxicology. You are going for lab investigation. So, obscure is minimal finding as a gross finding. Minimal finding as a gross finding with additional investigation. This is considered as an obscure autopsy. Like sometimes there is a head injury, a bruise on the head. You have the bruise on the head. That's a minimal. So you can see in head injury, you have the bruise on the head. But no other gross finding, like no other internal finding, no epidural hematoma, no subdural hematoma, and you are going for other things, histopathology of the organ or something else. Then it is known as obscure autopsy. So in obscure autopsy, you are not sure about the cause of death. It is an inconclusive, or I would say the minimal finding you are getting. That's the difference. And you are going for additional investigation, histopathology, toxicology, and lab investigation to confirm the cause of death. This is known as obscure autopsy. This is known as obscure autopsy. A very, very important. Another very, very important. So I would say obscure autopsy is a minimal gross finding. Negative autopsy is a completely negative autopsy. Now, I'm coming to the postmortem techniques. So how would you remember the postmortem techniques? The first method of the postmortem technique is virtuous method. Virtuous. And you can remember a very, very simple word. Virtuous is a very, very common method. Or I would use a word, most common method. Virtuous. Very, very common method or most common method. So V for virtuous, we can put it the same sound. V for one by one organ removal. It is one by one organ removal. It is one by one organ removal. We open the body, We are taking every organ out: liver, lungs, spleen, intestine, lungs, and I like every stomach, every part is taking out one by one. This is known as virtuous method. And my dear friends, it is a fast method, easy method. It is a fast method and easy method. Fast and easy method. It is the most common method, known as virtuous method. So it's very simple. V, virtuous, it's a V, one by one organ removal. This is known as virtuous method. It is the most common method for medical legal autopsy in India. Most common method. Now I'm coming to some very, very simple trick. GB. What is GB? Ghon's method. Ghon's. G for Ghon's. B for it's a en bloc method. It's en bloc method. Actually, sir, we are taking block out. Targeted block out. These are the targeted block. You can see what are the targeted block we have. Yes, my dear friend. It's a C for cervical, T for thoracic, or abdominal, or pelvic. We are not taking every organ. We are taking block out. We are taking block out. If we require cervical, cervical block out. If we require thoracic, we'll take thoracic block out. If we require abdominal, abdominal block out. If we require pelvic, we'll take the pelvic block out. See, if we know the, like this is a case of thoracic problem, we'll take the thoracic block. If we know the sexual assault, we'll take the pelvic block. Not taking all blocks out. We are taking targeted block out. Just remember GB, Ghon's, it's a block out. And observe, it's a inter-organ relations are maintained. So, but only inter-organ relations are intact. But we are taking only block out. It is known as Ghon's method. Ghon's method. Now, L for luteal, L for we are taking large mass out. Very, very important, sir. L for luteal, we are taking large mass out. Actually, we all know cervical, thoracic, abdominal, pelvic. All organs are connected with each other. So, my dear friend, it is all are connected with each other, and we are maintaining the integrity of these organs. So, in Ghon's, it is taking one by one block out. Here, all the organs are connected. So, we are maintaining the integrity. It is large mass, cervical plus thoracic plus abdominal plus pelvic. All are integrated with each other, taking out. It is an evisceration. The complete viscera are taken out. It is also a fast method, but we need a meticulous autopsy. We need a meticulous autopsy. Here, the blood supply and vascular supply are intact because all are connected with each other. So, if we want to see a minor damage or minor bleeding, if we want to see the minor damage or minor bleeding, we can go for luteal method. It is a luteal. L for luteal. Here also, your inter-organ relations are maintained. But what is the difference between Ghon's and luteal? Luteal is en masse. It is en masse method. We are taking the whole mass out as an evisceration. En masse. Ghon en block, we are taking block out. That's a very, very simple difference. So, if you were to get a question, sir, if you want to ascertain a simple bleeding, which method can be used? That is the luteal method. Evisceration and mass. GB, Ghon's en block. V virtuous, V one by one. It's a most common method. But sir, now I'm coming to very, very important method. Rokitansky. Sir, if you see the word Rokitansky, it has I and N. Okay, I and N. So it is a in situ method. It is a inside dissection. We are not taking any organ out, and it is done in infectious disease. And if you want to add one more in, it can be used in infant. A small child less than 1 year of age, we can use this method. So everything is in. It's a Rokitansky method. So we are opening the body. The all parts are intact. We are dissecting inside the body. We are dissecting inside the body. It is Rokitansky method. It is done in infectious disease which are highly transmissible. Example, HIV, hepatitis, COVID, COVID-19. So these are the example where we can go for Rokitansky method inside dissection, because these are highly transmissible disease. If we are taking a longer time, there are chances of transmission. This is known as Rokitansky. Now, like one question most of the people used to ask, in COVID-19 cases, if someone died due to COVID-19 coronavirus, which postmortem technique is required? Sir, see, COVID-19, if someone died, definitely there will be hospital record. There will be hospital record. So if you have the hospital record, no need of conducting postmortem. No need of postmortem examination, because it's a highly transmissible disease. No need of postmortem examination because it's a highly transmissible disease. But, if it's a medical legal case, if you get a question like COVID-19 patient like died due to accident, or if it becomes a medical legal case, unnatural death, in that case, you need to conduct the postmortem. In that case, if it is a medical legal case, you need to go for Rokitansky method. If it is a medical legal case, otherwise no need for COVID-19 or HIV cases postmortem. We just open the body. It's a Rokitansky method, but otherwise don't go for the postmortem if it is a hospital records are available. That's very, very important. Now I am coming to some very, very important type of incision in medical legal autopsy. The first, which is the most common type of incision, is I shape. First, the most common type of incision is I shape. What is I shape? Incision is started from the chin. Yes, my dear friend. Yes, chin. Then it is going downwards till pubic symphysis. Incision is started from chin. Then it is going to the pubic symphysis. This is the I shape. So if you had a question, the most common type of incision which is done in medical legal autopsy, it is I shape. Opening and examining everything. It's I shape. Now, sir, second one. This shape is Y shape. Y shape. And my dear friends, I'm telling you a very simple joke. Very simple. Y. We used to say Y in everything. Female. So Y shape incision, it is done in female. Actually, the purpose is cosmetic. Purpose is cosmetic. Now, it is started from, yes, from this side. Acromion process. Yes. It is started from acromion process. Okay. Then just preserving the mammary lines below the breast. Yes. Just preserving the mammary line or below the breast. Then it is coming in the center. That is Jiffy sternum. Then it is coming in the center. That is Jiffy sternum. This incision. Then it is going downwards in pubic symphysis. Yes, it is pubic symphysis. So you can see starting from the acromion process, mammary line, just below the mammary line, then preserving the breast, then pubic symphysis. This is known as Y shape. And the trick I told you, we used to say Y, female. Now I am coming to the modified Y shape, third one. So we have already discussed I shape, Y shape. Now I am coming to modified Y shape. Modified Y shape. So first you have to remember, this is done in asphyxial death. This is done in asphyxial death. Example of the asphyxial death are hanging, strangulation, throttling, drowning. So hanging, strangulation, throttling, and drowning, we use the modified Y shape. Now, from where we are taking? We are taking the incision from MP. What is the meaning of MP? It's a mastoid process. It is the mastoid process. So we are taking mastoid process behind the ear, then coming to the neck, then it's a straight line going to the, so it is mastoid process, yes. Then it is going to the neck, and it is the notch, which is suprasternal notch. This is SSN. What is SSN? It is suprasternal notch. SSN is suprasternal notch. So you can see behind the ear, that's a mastoid process, yes. Then it is suprasternal notch, and then you can see the straight line. This is pubic symphysis. So again, I'm revising all the important component. What is the I shape? Starting from the chin, going to the pubic symphysis, most common one. What is a Y shape? It is making the Y, acromion process. Yes, this one, simple. And going as a straight line. Y, female. Y, female. And modified Y shape. It is starting from the mastoid process behind the ear, then suprasternal notch, then straight line. It's a very, very important. Now, X type of incision, generally it is not done, sir, but we can see, especially on the back of the body, this one, back part. So, it is X incision, generally not done. We are taking from the shoulder. From this shoulder, it is iliac crest, IC. From this shoulder, it is IC, iliac crest. So, from one shoulder and the opposite shoulder, it's a back. This is for the deep injuries. Sometimes the deep bruises, these we can use, deep injury or deep bruises. It is done in custodial death. For deep injury or deep bruises, it is done custodial death. This is X incision. So you can write down this is 4th type. Number 5th type, inverted Y shape. Generally, we don't use this also. Inverted Y shape. What is inverted Y shape? So see, this is starting from this chin. Just above the umbilicus, it is divided into. This is your umbilicus. This is inverted Y shape. Sometimes we use T shape. T shape. What is the T shape? What is the T shape? It is from shoulder to shoulder. This is shoulder. This is shoulder. So from one shoulder to another shoulder, yes, this one. Then we are making a straight line. This is T shape. But sir, generally these are rare incision. Again, I'm telling you X shape, back of the body, shoulder to the iliac crest, shoulder to the iliac crest. This is X shape incision. Okay, for deep injury in custodial death. Inverted Y, ulta Y. Inverted Y का ulta Y. What is inverted Y, sir? You can see it is this just above the umbilicus divided into. It's inverted Y. It is, you can remember IN for inverted, IN it is done for infant. IN. T shape, shoulder to shoulder. Yes, this is shoulder to shoulder, and it is straight. Then it is straight, shoulder to shoulder. Then it is straight to pubic symphysis. This is T shape. So these are some very, very important types of incision. So I'm revising. Most common I shape. In female, it's a Y shape for the cosmetic purpose. In asphyxial death, it's a modified Y shape. X type incision in custodial death. Inverted in infant, and T shape not generally used nowadays. So we have seen the types of postmortem techniques and the types of incision. But now I'm coming to which is the first cavity of the body generally opened in postmortem examination. In postmortem. Now, sir, if you don't know any specific reason and the cause, the first body cavity opened, it should be thoracic cavity. It should be thoracic cavity. That's very simple. But if we have the specific case, like I'm giving example, newborn. If you want to go for the postmortem of the newborn, the first body cavity has to be opened. That should be abdomen. That should be abdomen. What is the reason? Because when you open the abdomen, you can see the position of diaphragm. You can see the position of diaphragm. Position of the diaphragm. If the position of diaphragm is lower, it's a live bone. If it is higher, it's a dead bone. We can see the respiration has taken place or not. Yes. Position of the diaphragm, we can actually estimate the respiration, whether it's been taken or not. So, very, very simple word. The first cavity to be opened in newborn is abdomen. Now, in poisoning case, if it is a suspected case of the poisoning, the first cavity to be opened is a cranium. Cranium, I would say it's a brain, cranium. First cavity to be opened is cranium. The reason is the best smell of the poison can be perceived by brain. So poisoning cases, the first structure to be opened, because we are discussing the cavity to be opened first. Now, my dear friend, asphyxial death. You have to remember a trick, C, tan, C-tan. This is the sequence we have to follow in asphyxial death. So in asphyxial death, we have to follow C, T, A, and C-tan. What is this? C for the first cavity to be opened is cranial. Then it's a thoracic. Then it is abdominal cavity. Then the last is neck. So you can get both questions. Which is the first cavity to be opened? The answer is cranium. Which is the last cavity to be opened? The answer is neck. Now, what is the reason behind this? Why do we open neck as the last cavity? Because we want neck as a bloodless field. We want neck as a bloodless field. The whole blood from different part is extravasated, or blood goes in other cavity, cranial. So we want neck as a bloodless field. Like I'm giving example, it's a case of throttling or hanging or strangulation. Everyone knows in throttling we have multiple bruises over the neck. In throttling we have multiple bruises over the neck. And if the blood from the other cavity goes in the neck, it will be the wrong finding, my dear friend. So we want the blood extravasate in other cavity. We want neck as a bloodless field, so we can get the exact finding of the throttling. We can get the exact finding of the throttling. So this is a very, very important part. In asphyxial death, the last cavity to be opened is neck. The first cavity to be opened is cranium. The trick is C-tan, C-T-A-N. Now in traumatic head injury, my dear friend, in traumatic head injury, the first cavity to be opened is head. And there are some contradictory statements in few books that it is written the head has to be opened as the last cavity, but just follow. This is head is the first cavity to be opened. Now, my dear friend, air embolism or pneumothorax. What is pneumothorax? Air in pleural cavity. Air in pleural cavity. So if you have air in the pleural cavity, what you will do? You will open the thorax first, chest cavity first. You will open the chest cavity and you will take the skin flap out or up. And after this, you will fill this with water. You will fill this with water. Now, what you do? You puncture the pleura. Fill this with water. Now, you puncture the pleura. If bubble comes out, that means your water test is positive. Your pleura has air. That is the very, very important part. So one thing is clear. In this, air in the pleural cavity is the pneumothorax. We open the thorax, skin flap is taken out or up. Then we fill it with water. And if we puncture the pleura, if bubble is formed, it is known as water test. Same thing we can do for air embolism. What we do for air embolism? Yes. We open the pericardium. Then we fill it with water. Now we puncture the ventricle. My dear friend, again, if the bubble comes out, that is a water test positive for air embolism. Again, that we are opening the pericardium, putting the water, puncturing the ventricle, and if bubble comes out, this is positive air embolism. Now, we can use one more method, another very, very important method for air embolism. We take a syringe. And in syringe, we have a solution which is known as pyrogalol. We have a solution which is known as pyrogalol. Now we aspirate the blood from the ventricle. We aspirate the blood from the ventricle. If air present in the ventricle, we aspirate blood from the ventricle. If air present in the ventricle, the color of the pyrogalol becomes brown. This is a pyrogalol test. So I'm highlighting every point again and again. This is a pyrogalol test. Yes, pyrogalol test. This is a water test. And this is again a water test. So this is how we go for the very, very important finding of air embolism and pneumothorax. Pyrogalol gives brown color if air is present. Bubble is formed if the air is present in pneumothorax as well as in air embolism. So this is very, very important topic. How do we go for postmortem in these cases? Now, organs to be dissected, my dear friend. Organs to be dissected. Actually, brain is an organ which is highly breakable, I would say, after like death. It's a very soft organ, easily breakable. So what we do? We can go for the brain examination now without fixation or with fixation. If we fix the brain after death, we fix in 10% formalin. And this we put for 1 week. This we put for 1 week. And we can go for without fixation also. If the brain finding is not important, we can go for without fixation also. Now, without fixation or with fixation, what we'll do? After this, we'll go for dissection. Dissection with or without fixation, we'll go for 1 centimeter interval. 1 centimeter interval in coronal section. In coronal section. And also for fixation, as I told you, we use the formalin. How do we fix? For this, we take a bucket. In this bucket, we take the formalin. Yes. And we use a string. By this string, we put the brain. By this string, actually, we are putting this string in the basilar artery. Basilar artery of the circle of Willis, and then we are putting the brain. This is the brain is inside the formalin, and this is how we fix the brain. But anyways, these two are very important. Fixation for 1 week or 2 weeks sometime, and we can go for without fixation. But the section is done 1 centimeter interval in coronal section. Heart. Sir, for heart dissection, we use inflow-outflow technique. Inflow-outflow technique. What is inflow-outflow technique? Right atrium, right ventricle, then left atrium, then left ventricle. So right atrium, right ventricle, left atrium, left ventricle. We all know after right ventricle, it goes to the pulmonary artery and we dissect up to the lungs. And left atrium, left ventricle, then we dissect up to the aorta. This is the technique, inflow-outflow technique. But again, I'm highlighting, my dear friend, it will start from the right atrium, then right ventricle, then left atrium, then left ventricle. Right atrium, right ventricle, left atrium, left ventricle. This technique is known as inflow-outflow technique. We will examine the aorta, pulmonary artery, and every chamber. Everything will be examined. Now, my dear friend, spinal cord. Spinal cord we can dissect, like there are some spinal cord poison like strychnine. Or there are like say, traumatic spinal injuries. In both cases we do. So spinal cord we can open anteriorly as well as posteriorly, but the better technique is posteriorly. The better technique is posteriorly. Very, very important. Brain, heart, and spinal cord dissection during postmortem. Now, sir, a very, very important organ, that is stomach. First, you have to keep in your mind, sir, stomach is open from greater curvature. Stomach is open from greater curvature. Why not lesser curvature? I will tell you. And my dear friend, for stomach, we use double ligature method. We are using 2 ligature on both ends. We are using 2 ligature on both ends. Everyone knows this is the cardiac end of the stomach and this is the pyloric end of the stomach. We are using 2 ligature. This is ligature number 1. This is ligature number 2 on one side. This is ligature number 1 and this is ligature number 2 on another side. And then we put the cut in between. So the stomach contents are preserved, not destroyed. These are present in that. Then we cut that part. Now, my dear friend, why we are opening it from greater curvature? Because if you have the acid or corrosive poisoning, the maximum damage is on the lesser curvature. This is your lesser curvature. The maximum damage in the lesser curvature. This phenomena is known as mesentery. So, Dr. Saab, to preserve the lesser curvature, to see all the finding of the lesser curvature, we open it from greater curvature by double ligature method. This is 2 ligature on both sides, cardiac and pyloric end. Cut between these 2 ligature. Open with greater curvature and examine the lesser curvature, because maximum damage in the corrosive poison, it is on lesser curvature. Organ to be dissected, these are less important, but still small intestine and large intestine. Small intestine is dissected from mesenteric border. It is from mesenteric border, and large intestine from anterior tinea. Liver is dissected by some parallel dissection. The parallel lines are important for dissection. The parallel dissection technique, we are taking small slices, parallel dissection. This is how do we dissect. But sir, small intestine from mesenteric border and large intestine from anterior part of the tinea. Now I am coming to a very, very important word, exhumation. Sir, if you remember, I told you in the court of law chapter, exhumation is digging out of the dead body. What is exhumation? It is digging out of the dead body. Digging out. Exhumation doesn't mean it's autopsy. Digged out the dead body in presence of magistrate. I told you exhumation is a magistrate inquest. So, very, very important, sir. It is a magistrate inquest. It comes under 176 subclause 3 CRPC. I told you PM, police magistrate, choka chakka. So, exhumation comes under magistrate inquest. And at the time of exhumation, there should be magistrate, there should be police officer, there should be doctor. That's what we require. It is digging out of the dead body. But just remember, my dear friend, after digging out of the dead body, we go for autopsy if needed. Autopsy is there. And my dear friend, it's not a primary autopsy, it is a secondary autopsy. So exhumation, if you get a question, what is the meaning of exhumation? It's a digging out of the dead body only. This is exhumation. Then we go for autopsy. That is a different thing. Autopsy is required. Now, magistrate, police and doctors, these are the people required. 176 3 CRPC. Sir, first identify the site by the help of relatives, accused, anyone. Identify the site. And after identify the site, exhumation is started early in the morning. Why it is started early in the morning? Because we require the whole day light. Bright daylight we require. That's why it started early in the morning. So exhumation is done early in the morning. There is no time limit of exhumation, sir. Sometimes the area covered are very much high, so we can require few days also. So there is no time limit for the exhumation. A very famous case, Nithari Kand, we all know that. So there is no time limit for exhumation. Let's have in exhumation what we take: soil sample, 500 gram of soil sample from where the body has been digged out. We take the soil sample, and just remember, we take that soil sample and we take the control soil sample also for comparison. Control sample are also taken for comparison. So we find anything in soil like the stain, hair, or the poison, we can detect. The soil sample are very important for traces of evidences. We can take if any tissue or any part of the tissue is found there, or we can take bones also. If the bones are there, we can take out the bones and we can go for chemical analysis of tissue or bone. Chemical or toxicological analysis of tissue or bones. That's what we go for. Now, my dear friends, sometime, like see, there is a arsenic. And my dear friend, arsenic is present in the soil. Arsenic is present in the soil. From soil, arsenic can go in the dead body, my dear friend. This phenomena is known as postmortem imbibition. Means the arsenic is present in the soil, but it can imbibe in the body. It can imbibe in the dead body. This phenomena is known as postmortem imbibition. Postmortem imbibition. So, my dear friend, this chapter exhumation is also very important. Magistrate, police, and doctor 176 3 CRPC it comes in. Take the sample, soil sample, take the tissue sample if it is present, take the bones and examine. So why do we preserving the bone? Because like the many heavy metal poison are found in the bone. Heavy metal poisoning are found in the bone. And the arsenic or sometimes antimony that can go inside this. This is known as postmortem imbibition. That's very, very important. No time limit for exhumation. No time limit for exhumation. Now I am coming to few simple definitions, sir. What is the meaning of antemortem thrombus and what is the meaning of postmortem clot? So you can get few questions. Antemortem thrombus is firm, dark red. It is a dark red stria of Jahn. It is present. What is stria of Jahn? Fine white lines of fibrin. This question comes in exam. What is the composition of stria of Jahn? It is a fine white lines of fibrin. That's a very important characteristic of antemortem thrombus. And my dear friend, coralline platelet thrombus, alternate layer of platelet and fibrin. So both questions are different. What is stria of Jahn? It's only fibrin. Coralline platelet thrombus, it's a platelet plus fibrin. Alternate layer of platelet plus fibrin. So this phenomena is antemortem thrombus. What is a postmortem clot? Red currant jelly. That blood clots rapidly. Red currant jelly or chicken fat clot. Clotting process is slow. So red currant jelly, clotting process is fast. Chicken fat clotting process is slow. Both are example of postmortem clot. So just remember what is a stria of Jahn, what is a coralline platelet thrombus, and what is a red currant jelly, and what's a chicken fat clot. You can get a question. Now, sir, a very important word comes, that is a sudden death. When do we say that the person is having sudden death? Sir, sudden death means a person was not having any dangerous disease, not having any injury or poisoning, but still found dead within 24 hours after the onset of terminal illness. No dangerous injury, no dangerous disease, no the poisoning, but still the dead body was found. Or if you found dead within 24 hours of the onset of the terminal illness, this is known as sudden death. Means suddenly died. You suddenly precipitated, like you don't have any disease, no symptom of the BP, no cholesterol symptom, but suddenly you died within 24 hours of the onset of the terminal illness. This is known as sudden death. And Dr. Sab, left anterior descending artery within 2 centimeters of its origin is most commonly affected. LAD. And my dear friend, LAD is also called as a widow's artery. Widow's artery. So just remember two things. What is a widow's artery? Where it is, which part is most commonly affected? Within 2 centimeters. And what is a sudden death? If you found dead within 24 hours of onset of terminal illness. Very, very potential MCQ. So my dear friend, this was a very, very interesting chapter. Postmortem techniques we have discussed. Very, very important, because this is the chapter we should know while conducting postmortem.